Back in New York, Governor Kathy Hochul is expected to drop the state's indoor mask mandate today, and that is according to a report from the New York Times. At this point, it's unclear, though, if she'll renew a separate mandate for schools that expires in 2 weeks. Similarly, in Illinois Governor J.B. Pritzker is expected to announce plans today to roll back indoor mask mandates as Democratic-led states start to ease restrictions after that crushing Omicron wave. The question that we're asking, is the U.S. ready to treat the pandemic as an endemic? Well, here now to discuss is Dr. Amish Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Dr. Adalja, thanks as always for being here. So we just outlined a few of the numbers there and a few of the lifting of restrictions that we're seeing nationwide. Is this the period where we're transitioning to an endemic?
I do think that it is. The Omicron surge infected a lot of people, and we've seen a collapse in the number of cases, and we're in a much different place as we get on the other side of this Omicron surge in terms of immunity in the population, more availability of antivirals, monoclonal antibodies, rapid tests, and the population has learned how to risk calculate a lot better than they could early on. So I do think it's time to start thinking about what mitigation strategies can be rolled back and starting to give people the tools to be able to live their life, recognizing that there's always going to be some COVID risk, but a much more manageable COVID risk.
Is there concern, though, especially because we outlined sort of what different governors are doing in different states, is there any concern among the health community that this sort of patchwork of lifting of restrictions could potentially create another wave down the road? I mean, this is going to be different depending on where you are, if you have kids in school or not.
Well, there's always going to be cases. We're going to see ups and downs. We're going to see hotspots and flare-ups. But I think we have to move from thinking about cases as something to worry about and really focusing on serious disease. Are hospitals in trouble? Are there increasing rates of serious illness? And increasingly, especially for those who are vaccinated, this is going to be a mild illness. And even for those who get severe disease, we're going to have tools like Paxlovid to be able to help them not need hospitalization. So we're going to move towards thinking about COVID-19 not separate, but as really integrated with influenza and other respiratory viruses and have a comprehensive respiratory virus strategy. But I don't think that kind of keeping in this perpetual state of emergency is going to change anything in the long term. It would be great if it was universal, if all the states were on the same page. But the fact is, many states have lifted mask mandates long ago. For example, Pennsylvania, which is a blue state where I'm from, has not had a mask mandate for a long time. So it's a little bit interesting to me that there's a lot of concern about these 4 states in the last couple of days when other states like Pennsylvania and like Florida, like Texas, have not had mask mandates for quite some time. And remember, even if there's not a government mask mandate, if you feel uncomfortable, wear a mask. One-way masking works.
Yeah, and that's what I was going to ask you, too, because I'm curious, once these governors make these announcements, if people should just be taking off their masks or if they should still risk calculate, depending on where they are, whether or not they have masks on or not.
It all depends on each person's personal preference. There are going to be some people who are immunocompromised that are definitely going to want to wear masks in high-risk situations, but there are going to be others that don't. So masking is going to increasingly become an individual decision based on each person's risk tolerance. And I think that's a good trend because we want people to learn how to make decisions in a world in which COVID-19 is present. And if you're not worried about hospital capacity any longer, if you're not worried about people not having treatments, then I think we are in a place where this is going to increasingly fall to what individuals are comfortable with, and it's not going to be one size fits all.
And when we talk about severe illness, Dr. Adalja, there was a study this week that caught our eye in the Nature journal, and it talked about people post-COVID with long COVID and some of the risks that they may have. What are you learning as a health professional? What are you seeing in your hospital that maybe is still concerning that we still need to find out?
Long COVID is a real issue, and it's primarily something that occurs in people who are not vaccinated. It's much less likely to occur in a vaccinated individual. So one way to prevent long COVID is to be fully vaccinated. But we are seeing people have some percentage of people having a hard time getting back to their baseline status in terms of brain fog, fatigue, chronic cough, chronic shortness of breath. And this new Nature medicine paper shows that there is an elevated risk of cardiovascular disease in people who have recovered from COVID up to a year out. And that's not surprising because any level of inflammation that occurs in your body does put you at higher risk for cardiovascular symptoms to occur or heart attacks to occur. So this is just another reason why the vaccine is so life-saving, because it prevents you from having those long-term complications. So the solution to long COVID is to not get COVID to begin with, or to get a mild case of it because you're fully vaccinated. And for those people who have long COVID, this is going to be the long tail of the pandemic, where we have to deal with these health problems and set up clinics and try and unravel all the mysteries of long COVID.
But this is still happening. I mean, I've heard some situations where people who are vaccinated are still sort of falling ill, or having heart complications down the road. I mean, is there anything that people can do if they are vaccinated and potentially are still experiencing long COVID symptoms months after they've been ill?
As I said, long COVID is extremely rare in fully vaccinated individuals. However, there are clinics that have been set up at major medical institutions all around the country, and even in smaller places, where you can get plugged into a system where they're actually trying to give you treatment to understand what's going on. And I think it's the point that, and the other point is that we're at the infancy of understanding long COVID. We don't quite understand all the risk factors. We have some understanding of the risk factors, and we don't quite understand the trajectory. People do tend to get better over time.
And Dr. Adalja, I just wanted to finish on, just because we were looking at video of COVID-19 testing, and I think as we transition to an endemic, also people's decision whether or not to test or not is going to change. When should people be testing? Is it when they have symptoms? Should they still be testing once a week if they're going into offices? I mean, what is your guidance here?
They absolutely should test if they have symptoms, because they need to figure out what they're sick with, and they may be a candidate for treatments, and they need to isolate. For other people, I think it's going to depend upon what the organization wants to do. And some organizations have very low risk tolerances, some have very high risk tolerances. I don't think we know what the optimal testing strategy is. I think that frequent testing is probably going to go away in terms of testing asymptomatic individuals, as people become able to be kind of acclimatized to the fact that, yes, there's going to be some baseline risk of COVID-19, and no, we don't need to test people every day for COVID-19 when they have no symptoms, just like we don't test people for influenza every day when they don't have symptoms. So I think we will transition to that stage, but it's going to be kind of on a different timeline based on each company's individual risk tolerance, or each school or each organization on cases. I think we have to come to the conclusion, though, that there's always going to be some level of cases. We're not going to get cases down to zero, and you're never going to be able to completely isolate your organization from COVID-19. That's why the focus really needs to be on severe disease, not all disease, not all infections.
Severe cases or severe illness as opposed to just case counts. Is that what you're saying?
Correct. Yes, exactly.
All right. Dr. Amish Adalja, thanks as always for your time and for being with us this morning. He is a senior scholar at the Hopkins Center for Health Security at the Bloomberg School of Public Health. Thanks for your time. And we should note the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.